Hello everyone, David Wilson here again from Dr. Stem Cells. This is part of our PRP series where we look at the American Academy of Orthopedic Surgeons and their technology overview when looking at PRP for knee osteoarthritis. So here we are, this is the overview, American Orthopedic. If you're looking for it, you'll see it here. Remember to take a quick look at the disclaimer. And as we come down here, today we're going to look at PRP versus ozone and PRP versus prolotherapy. Now, ozone is the injection of oxygen, radicalized oxygen, and prolotherapy is the injection of 5% to 15%, in some cases up as high as 50% dextrose solution, so that's a sugar water solution. Obviously both are sterile and used under a sterile technique. The reason I want to discuss these both together is because prolotherapy is in many ways the grandfather of regenerative medicine. Prolotherapy was the original theory to try and encourage the body to heal by actually stimulating a little bit of injury, a little bit of inflammation. And we know that dextrose solution or sugar solutions are actually very pro-inflammatory. So if you inject those in around a tendon or into a joint, you're going to cause irritation of the surface, and you're going to get actually an innate immune response, which is going to come in and try and help to calm things down and maybe cause some healing. Ozone is based on a similar principle. It causes an irritation to the tissues and will hopefully induce an immune response, which can give people benefit. So let's take a look at this review. One high quality study. Unfortunately, both these look at small studies with a small number of patients. So we're getting to the stage of this technology overview where we're starting to see the very clear real world limitations of the studies that are done. There are too few studies, and often they don't have enough patients to really make some sweeping claims. So again, these are not going to be sweeping claims. We're just trying to understand why the findings here are the way they are. So one high quality study and two moderate quality studies were included for ozone. And if we look at the two, we can see that the PRP in this paragraph here we go. In one high quality study, comparing the two treatments, PRP had significantly improved VAS, visual analog scale, PN scores at 12 months. In the two moderate quality studies, they had significantly better improved at 3 months and at time points up to 12 months after injection. The high quality study comparing these two treatments, PRP had significantly better WOMAC, pain, stiffness, and function scores at 12 months after injection. Both moderate quality studies reported improved outcomes for PRP and WOMAC function scores. So ozone offers short-term benefits that dissipate quickly, while PRP seems to present longer lasting results. This would be in keeping with what we expect, because ozone, by its introduction, and actually let's just talk briefly about prolotherapy and then we'll get to my chat. Okay, so prolotherapy then, one high quality study and one moderate quality study. So again, you see that we're getting to small study numbers. Only 102 patients were evaluated here with PRP versus prolotherapy. In the high quality study, PRP showed statistically significant improvement in outcomes compared to prolotherapy for WOMAC, composite function, stiffness, and pain scores, and no statistically significant difference in outcomes in one moderate quality study on the same WOMAC score. There's insufficient evidence to clearly support the superiority of PRP or prolotherapy in the treatment of osteoarthritis of the knee. Further randomized controlled trials should be useful to establish PRP or prolotherapy superiority. And I would agree with that assessment. However, let's take a quick think again about how PRP works and what the difference practically for the body is. Ozone therapy and prolotherapy, as we discussed earlier in the video, are both examples of treatments which try to encourage the body to have healing based on an inflammation that is actually generated by the injection itself. PRP, by comparison, is taking platelets which will stimulate the healing cascade. We've talked about that in previous videos, and those platelets are concentrated up and injected in a much higher dose than the body would naturally be having access to in such a short time without a larger injury. So as we consider the difference in approach, we start to see why there might be some limitations to what ozone and prolotherapy can provide. That is because these treatments, even if they cause an irritation, that healing cascade that will continue and build on the original irritation or inflammation produced by these treatments is going to be somewhat limited in that it's never going to be more than, if we want to call it 1x, of the body's healing cascade activation. You're not bleeding into the tissue, you're not having platelet activation there and then, you're actually causing rather a different healing cascade, but using similar cytokines, and the body's going to have an immune response and going to try and build up. On the other hand, a PRP, because the platelets are concentrated up to between 5 and 7 times the body's natural concentration, you're going to have a significantly higher platelet count. In fact, You might not even have platelets if you do your prolotherapy or ozone therapy with a careful technique. So you're going to have platelets to stimulate healing. They produce and increase inflammation. They produce and increase the amount of growth factors and cytokines that are present, and will actually stimulate tissue healing, both by factor of them being present and because they release all of these pro-inflammatory and pro-healing hormones and cytokines. That's why I personally feel that PRP would be superior to prolotherapy or ozone therapy. There is, however, one last thing we can't say much on, and that is your cost to benefit ratio. I'm not sure how much a prolotherapy or ozone therapy costs, and that will vary from region to region depending on access to these treatment modalities. This is something to discuss with your patient. However, I think we can suggest that there is some early tentative evidence that pushes us towards more in favor of PRP, and certainly when we look at why the healing cascade is the way it is, that would push me well over into the camp of saying that PRP should be superior simply from a physiological basis. If you'd like us to do a more deep dive into some of these other treatment modalities, I would be more than willing. Leave us some comments down below and we'll get back to that again in the future. See you in the next video, and thank you very much for joining us today.